welcome everybody to the latest edition of the Inside Track. We have a fantastic guest with us this afternoon. Amy Bantham, how are you?
I'm doing well, Ryan. Thank you so much for hosting me. And Dr. G, always good to see you.
And you, Amy. It was Ursa, wasn't it? Our last little get together.
It was a couple months ago, and I've been to a conference since then. I just got back from the ACSM conference in Denver, so I missed you there.
Oh, nice. What was the big takeaway from there, Amy?
The big takeaway from that conference, it's only the second time I've attended in person. I presented virtually a couple years ago and then in person this time. And I was really excited about the engagement from the audience in our session about the exercise professional of the future.
Wow.
We presented for 2 hours and then people stayed an extra 30 minutes.
Oh, wow.
So that gave me a lot of hope that people are thinking about how we need to evolve our skills as exercise professionals in order to meet the changing needs of clients and members, and how we need to raise our game as exercise professionals in order to integrate with healthcare. So I came away very
love that. We'll need to ask you a little bit about that as we progress through this next 45 minutes or so. It would be really great, Amy, for all the people out there that listen to us on a regular basis, for you, although we know who you are and what you do, would you just give everybody a little whistle-stop tour of what got you to here?
A whistle-stop tour. I love that. So where here is I am the CEO and founder of Move to Live More. It's a research and consulting firm. I started it about 3 years ago now. And here is also, I'm serving a 1-year term as the president of the Physical Activity Alliance. So I can talk about both of those more in detail. But what got me to here, I actually started in the health and fitness industry in the mid to late 90s as an exercise professional. And I taught group exercise. About 10 years later, I became a personal trainer. About maybe 5 years after that, a certified health coach. And I was so passionate about helping people move, be active, get healthier, be happier. And I had a day job at the time. I was serving as a management consultant, but I was teaching group exercise during my lunch hour. And I realized that was what I was really excited about. So I ended up...
Isn't that interesting? You can have such a highly powerful job, because it is. I mean, it's a really strong job being a management consultant like you were, to then go and actually, I'm going to go teach on my lunchtime. Yeah. I mean, they couldn't get any more yin and yang from a job perspective.
Yeah, and I was able to combine those two things. I've taken the management consulting skills throughout my career and running my own business now. And then the group exercise, I still teach group exercise, but I really got engaged with the industry in 2006 when I joined the staff of IHRSA. And I worked with IHRSA as a full-time employee for 11 years.
Wow.
I helped them start their foundation, which was really focused on helping health and fitness centers open their doors to people with chronic disease and disability. And as I was doing that more and more, I recognized that I needed some more skills, some more expertise. And so I went back to school and got my doctorate. And I spent a couple years doing that. Dr. G, you know how long that takes. And there were two really pivotal experiences when I was doing that. One was I was working for a large healthcare system out in Utah, and I was helping them start a pretty innovative project where they were bringing healthcare out into the community in order to address people's basic social needs. And so, yes, there was a food component, there was a physical activity component, but it really got me thinking about how to take healthcare out of the clinician's office and bring it out into the community. My second really pivotal experience during my doctorate was I evaluated a physician exercise referral network. So physicians were they were referring their patients to a hospital-affiliated health and fitness center or to community-based health and fitness centers. And so I really dove deep on what were the barriers to physicians prescribing and referring physical activity. And so those experiences really prompted me to launch my own consulting firm, because I didn't really see that anyone was doing what I wanted to do, which was to link all three of those sectors: health, care, health and fitness, and communities. So that's how I came to be where I am right now.
I can imagine that's a really interesting model as well in America. I mean, obviously, we're vastly different in the UK when you think healthcare and fitness, just because obviously our NHS is free, whereas over in the States, it's very much they're all paid for models. So to try and link the three, you're not just worrying about the individual who's ill and who needs support, but you're also thinking about the financial benefits of all the different players in there as to what is their incentive to join such a scheme. So I can imagine trying to link the three together is quite a difficult one to work on.
I love challenges. And it's funny when I talk on panels, they'll often have me go first because I focus a lot on challenges and barriers. And so what's the problem that we need to solve? What's the pain point? And I learned from my research, yes, Ryan, exactly as you say, cost is a key challenge to address. So in addition to cost, I found that physicians really aren't talking with their patients about physical activity. They're not prescribing and they're not referring out for a couple main reasons. One is time. They simply don't have the time in a 15-minute office visit. Training, they simply didn't feel like they had the knowledge and expertise to have those all important conversations. Tools and technology. So really it came down to an electronic health record system that supported them in their ability to do that and then linked them to a qualified exercise professional. Okay. And so that's a lot of the work that I'm doing with the Physical Activity Alliance right now. Trust. They didn't know who to trust, what qualifications of an exercise professional they could trust to send their patients to, and then that cost issue. And people say to me, you need a cost equivalent that starts with T, because you've got the time, tools, training, technology, trust, and then cost. So really, those are the main barriers.
Does stand out though, the cost one at the end, doesn't it?
It does.
It's really fascinating, Amy, because I know that when you and I had our first introductions to each other, we had this real alignment in our passion for getting people to move. And what we are seeing in the corporate space right now is the corporate organizations globally are very concerned about the lack of movement. And I know that you've heard me say this before, but as a resilience expert myself, I feel like we try and fix our thinking with more thinking, when I actually think that one of our key challenges of why our thinking's not always so good anymore is because we don't move enough. Because we know when we move, where energy goes, where movement goes, energy flows, right? So we're seeing this real issue where our school children are not moving enough. Our corporate demographic is not moving enough. Essentially, none of us are moving enough. So it was absolutely fantastic when I heard about the business that you'd set up, this move to live more. What does that mean? And, what was the challenges there, and what success have you been getting? It would be really lovely to hear more about it.
Yeah, thank you for that question. And you're right, you and I share that passion. And it's really about changing mindset, changing language, changing culture. Move to live more. I spent a lot of time thinking about the name. I do think I'm a health communicator. I really think language is very important.
Yeah.
So I wanted to focus on movement, and I wanted to focus on lifespan and health span, and really thinking about quality of life. So we're moving to live longer, and we're moving to live better. And so I work with clients all across the spectrum, from large nonprofits and foundations to mom and pop, sole proprietor health and fitness centers who are thinking about how they can be more connected to their communities so they can get not only their members, but their potential members and their community at large moving. And I work across the lifespan. I work with entities that are trying to get kids moving, elementary school kids moving more. And I work with organizations that are trying to get older adults moving more.
Yeah.
And so I provide communication counsel, strategic counsel. I do program evaluation, and I help them put together plans to have more of an impact on their communities. Because you're right, Dr. G, we really, sometimes I'm incredibly optimistic about the progress we've been able to make. And then sometimes I see the statistics. I actually listened to a presentation by, I live in Massachusetts. It was one of our Massachusetts senators with the U.S. Surgeon General, and they were talking about the youth mental health crisis. And the statistics are so sobering, about 1 in 3 U.S. teen girls considering suicide. And they were talking about all the different ways that we can try to first of all, identify that we have a real crisis on our hands. And then second, really thinking about some of the influences. They talked about social media. They talked about the school closures, the lack of social connectedness, the learning loss, and the pressures. But one thing they didn't talk enough about was the connection between mental health, social emotional health, and movement.
Absolutely.
And so if we're thinking about all the tools that we have in our toolbox, because we need to use them all, that really physical activity is a really important one to address mental health of all ages.
Yeah,
we're all struggling of all ages, and how do we really think about what tools we have at our disposal? And we're all very much in the physical activity camp, and the evidence base is so strong. So how do we really equip different organizations and entities to be able to use evidence-based programming and services and qualified exercise professionals, and really help get everyone moving more?
I mean, it's not just the America though. Sorry, Glenda, it's not just America. We find the same thing in this country. We've very much got fitness, we have sport, we have the NHS, and none of it's connected. And it's I mean, we really struggle, don't we, Glenda, when we talk about it, and obviously when we get guests on, is the how to get all these different groups talking. Because, and quite often, I mean, we saw one the other day where the organisation given the right by the government, by this local council, £9 million to create this health and wellness, so to start linking the two, had no previous background in the industry, in fitness. They do the disability tests for the government. So if you're going to go for disability allowance, they do those. That's the only thing they've got. They've got no link. And you're sort of going, why are those organisations getting these huge contracts to help get the nation fitter when they have no background in it whatsoever? And this is the challenge. The wrong people are getting the wrong contract, and it's just all over the place. There's no connectiveness to go, we've got a problem. How do we bring all these different groups together to go, okay, now let's solve it? And I don't know what it's like in America, but it's certainly not happening in this country.
Yeah, I guess two thoughts about that. One is that I really moved to live more as a research and consulting firm, but I also started my podcast at the same time.
Yeah,
and you two will be able to relate to this. And the focus of the podcast is to feature thought leaders in these three sectors: healthcare, health and fitness, and communities, and to ensure that we're not working in silos.
Yeah.
We're reaching across the sectors to solve the problems of physical inactivity and chronic disease and unmet health-related social needs in the most innovative, collaborative ways possible. Because more often than not, we can try to solve these issues. They're not rocket science. In a lot of cases, the right hand simply isn't talking to the left.
Well, that's so interesting that you say that, because I don't always think we get enough credit in the fitness industry for how genuinely kind most club owners are, in terms of, yes, they want to make money, yes, they want to make a profit, but they ultimately went in and did what they did, most of them because they understood the value of changing people's lives through physical and mental interventions, yeah? And what I've never been more fascinated by is thinking about public health and the connection to both public and private fitness facilities. Because when you mentioned that the GP doesn't have enough time to do the brief intervention work, these fitness clubs have plenty of time. There's people going in there and spending 1 hour in these places. And there could be a lot of good, friendly discussions going on about the power of, why you're doing what you're doing. What could you do next? How can we best support you? And I just don't see that they've joined the dots there, that those services could be definitely more collaborative and vice versa with both parties, and everybody wins. We get the public health remit going through the roof, and we get club owners making a bit more money, because ultimately if people use their facilities, they're going to then retain them longer. And I just wonder, and then I'm thinking as well, what about, reaching out to the community, do a good thing, but then they become your funnel to become new members.
That's exactly right. You just described the model that my business partner, Tom Richards, and I use when we're helping commercial health and fitness centers be seen, be viewed, be valued by their communities as an essential community resource. And part of the process that we use is we actually sit down with them and we map out all the community stakeholders and where they sit, what relationships they already might have with healthcare, what relationships they might already have with small businesses, with the school system, with public health officials, with the media, and help them think about how they're already connected. And in a lot of cases, they're already doing the great work. They might not be framing it or messaging it in the way that they need to in order to raise the visibility and really be as highly regarded as they can be as a partner that is working to impact the health of community residents.
That's absolutely true, Amy. I mean, every single child at school has parents, whether they have one or two or a guardian, and those people need to think about their physical activity. So by doing a good deed, I always believe when you pay it forward, it will come back to you. And I just wondered, what progress do you think we have made in the fitness industry in doing that? Do you think that we've done a good job, or where do you think we could do better?
Again, overall, I'd say I'm cautiously optimistic. I'd say where we're doing a good job is really thinking about our language around movement and activity, recognizing that maybe the messaging that we've had up until this point, I mean, look at where we are in the sense that for decades, we've helped the fit get fitter. And that's been our model. And so how do we reach beyond to meet the needs of people who haven't felt welcome or included in our health and fitness centers. So I do spend a lot of time talking about and actually developing coursework for fitness professionals so that they can work with clients and members of many different body sizes, of many different fitness levels, conditioning levels, many different types of motivation. And really, so how can we use the language, the images, the evidence-based programming? How can we have the specialty expertise that we need in order to meet the needs of those clients and members who haven't felt that what we as an industry were offering met their needs or called to them. They couldn't see themselves.
You know, just as a real small takeaway, Ryan, I'm going to ask you, buddy, how many clubs can honestly say they have a walking club, a couch to 5K club, a cycle club, and all of those type of community-based movement activities would be a funnel into new membership.
Absolutely. And I think the biggest challenge, and I think a lot of us understand this, and I think you've just pointed it there as well, Amy, is it's trying to not only have the skill set to manage those members when they come in. So if we suddenly had a big influx of obese clients, for instance, what programs do we have in place to maximize that? To want to make them feel comfortable, secondly to get results, and obviously to because it's a massively different journey from someone who's pretty fit, pretty healthy, just switching gyms. They know what they're doing. They walk in, I'm comfortable in the gym, I'm just going to go do my thing. Then you get someone who hasn't trained, might not have trained for 10 years, might never have trained, might be 10 stone overweight. You know what I mean? And it's a completely different journey. And I don't think yet our industry wants that. It sounds horrible, but we don't want that client, and I don't think we attract it, and we purposefully don't try and find that client. One, because it's harder work. Secondly, we don't really know how to deal with the mental element of that client, because a lot of those people coming in with those sorts of conditions, there's a massive mental a lot of work you need to do around their mentality, their motivation, and everything else. And I think that's where we struggle as an industry. We like the fit coming in because they're like us. They walk in, they're like us. We can respond to them. We know how they feel. Right, we're going to get. If someone's a little bit overweight, we can deal with that because it's not too. Suddenly, when we start going into the sort of medical intervention stuff, now it's a different mindset, and I think that's where we struggle as an industry. I don't know what it's like in America. It's definitely like that here. And I think that's where we need to make the change if we're going to start getting significant penetration into our populations.
Yeah, my colleague, Dr. Rachel Pajednik, and I actually developed a 10-hour course for fitness professionals to equip them with the skills and expertise in order to be successful working with clients who have overweight and obesity. And one thing that was really important to us as part of the 10 hours, we had 10 different experts come on and talk about their perspectives. And one of the experts we had come on was someone who has obesity and who frequents health and fitness centers. And she spoke about her journey and her experience as someone with obesity who is a regular gym goer, and really thinking through how is the equipment positioned? Can people with obesity move comfortably among the equipment when they walk into the club? What type of images greet them? What type of staff greet them? Ryan, you made the point that we want people who look like us. Well, maybe we need to think about employing health and fitness professionals who look like them and really thinking about representation. And so really important things for us to think about as we emerge and evolve and grow as an industry.
I always think it's incredibly brave for someone who's, I don't know, size 20 and above, big people to walk into a gym. I think it's incredibly brave of them. I mean, some of them don't care. Their confidence is up and they're happy with it. But the large majority aren't. And I think for them to walk into a gym versus someone who's fit and healthy and fits into the norm and doesn't really stand out. I think it's an incredibly brave thing to do. And that's where we've got to flip that rhetoric, and we've got to go make it so it's normal for that person to walk into a gym as well as the fit and healthy person. No one cares. You're coming in to do your thing. You're going to get fit and healthy, but they don't. And I think that is one of the biggest barriers to us breaking that cycle, unfortunately.
Well, it's quite interesting because Amy said that she did a talk about the fitness professional of the future. Did you say, Amy? Mm-hmm. Now, obviously, you know, Ryan, I'm very passionate about the need for re-education and further skills development. Absolutely. I do think that our qualifications and diplomas in health and fitness need a bit of a rethink, because there's not enough psychology in there. There's not enough mental health support. I just wondered, Amy, what do you think, if we've got a crystal ball, what's the fitness professional of the future look like in your opinion, in your eyes?
Well, it was really interesting what from our presentations really resonated with the audience. And one of my colleagues, there were 4 of us who presented, got up and spoke about a survey they'd done about what is valued and prized as skills among health and fitness professionals. And the immediate thinking is, well, it's the science, it's the expertise, the hard skills. And what they found is that it was really the ability to support and facilitate behavior change.
Human skills.
The human skills. And that was very consistent with my research as well. I mentioned that I did a program evaluation of an exercise referral network that had been in place for about 10 years. It was a pretty long-standing, robust, successful exercise referral network. They did about 35 physician referrals every week to 4 different programs. So I was able to talk to the physicians, and I was able to talk to the health coaches, registered dietitians, and exercise professionals that were receiving the referrals as well. And what the clinicians told me is that they didn't really understand our world of certification, of certified exercise professionals. They didn't have the time to go out and sample and try each one. So what they were really looking for were proxies so that they could know and believe in the skills and expertise. So they were looking for really supportive, empathetic exercise professionals that they could hear about from their patients when they came back and said, I felt really supported in my health and fitness journey. And oh, by the way, these are the health outcomes that I was able to achieve. And oh, by the way, I didn't just fill the prescription once, I actually stuck with it. And I just completed 8-9 months of this program. So that was absolutely a theme to me that really stuck out, that it's the soft skills, it's the listening skills, it's the ability to support long-term behavior change, it's the ability to demonstrate that empathy, and it's the ability to get to the why people are embarking on this health and fitness journey.
You know, just in the spirit of what you're saying, I did have a vision once about, I'm sure you've all heard of Salesforce, the software company, and they do something called Salesforce Mums. Absolutely love it. The idea is to get mums back into being consultants after they've had their children. Mm-hmm. And they've got all this amazing life skills, and they've got experience, and they have this qualification that gets women back to work. And I thought, how many people out there are looking to come back into the world of work who would make the best fitness instructors, you know, understanding what it's like to be a new mum or a dad that's not had a huge amount of sleep because you've got young children, or, you know, understand what it's like to even be unemployed for a while and come back in. And just that life experience, I think there's something there that we're missing, that there's got to be someone build out a strategy to get these people engaged in our industry.
I love that. I think that's so key. And as we're, Ryan, to your earlier point, as we have an aging clientele, as people have multiple conditions, and thinking about the exercise professionals who can relate to that. I know that I still teach 3 hours a week now, 25 years into being a health and fitness professional, and I love
What do you
it.
teach?
I teach a cardio dance class, 30 minutes cardio dance, 30 minutes muscle conditioning, and then I do a straight up muscle conditioning class. And I have students who range from mid 20s to my oldest student is 87.
Yeah,
Wow.
unbelievable. Ryan, I always think that Amy's my long lost sister, because you know how much I love my spin classes that I still teach,
Mm-hmm.
because we all benefit. They benefit, you benefit, and you get the absolute joy of what exercise brings you, all the benefits.
All the benefits, all the joy. And I'm a researcher. So to me, it's a way for me to keep my finger on the pulse of the industry. I'm always gathering research. I test things out. I just finished a book, Dr. G. We talked about sort of what really is our passion. I know with you, it's a lot of workplace well-being. For me, increasingly, it's about getting kids moving. And so I wrote a book over the last year for parents, grandparents, guardians, about how to get kids moving. And I focused on the physical health, the mental health. I focused on academic development. And then I put a section in about self-care and representation and modeling.
Amazing.
And so I would test out different concepts and ideas on my members, on my students as I was going through the process. So it's a
Are they aware they're guinea pigs, Amy?
It's a win-win for
we love testing our experts, and we know that you're an expert in movement. What are the top 3 barriers, do you think, that have made this current society so sedentary? I mean, I do like to challenge people and say that I do believe part of our stress pandemic is because we don't move.
Yeah.
I genuinely mean that. So what's the top 3 barriers, do you think, why people are just not moving?
Well, it's interesting. Yeah, it's interesting. I just completed 31 days of daily social media posts about movement, because it was National Physical Fitness and Sports Month here in the US. And our tagline for the Physical Activity Alliance is "Move with Us." So to me, it was an invitation to everyone to move with us. Yeah. And so I think we like to vilify social media and the digital, and I do think that plays a role. I think there's a really interesting infographic that shows, I think it's like 9 hours a day that kids are spending on it. It is absolutely shocking. I tell my kids, and thank goodness they have the good sense to say, are there that many hours in the day? Like, how do they find the time? So I think that we're always looking for a villain. And to me, I think it's a lot of things. And I think we've mentioned some of them. I think it's culture. I think that we've really engineered physical activity out of our lives. And so now we intentionally and purposefully have to get it back in. And so I'm very focused on built environment and infrastructure and sidewalks and bike lanes. And the fact that in the US, 1 out of 10 kids walks to school on a regular basis, that is shocking and terrible. And we really need to, if they're not getting it at school because we're stripping away physical education recess, and they're not getting it to and from school because they're being dropped off, and we're having challenges with sports where the elite, very expensive sports continue, and the pandemic was very hard for in-town leagues and nonprofits that work to get kids moving through sport. So we're losing bits and pieces. So to me, it's a whole systems, whole culture approach to movement. So I do think a lot of it is the different touch points throughout the day, and that's why so much of my work with Physical Activity Alliance is focused on systems and policy level change, because we really need to use all of those levers in order to get people moving. We can't say it's, it's up to the individual, or it's the individual's fault, or it's just social media, and try to pick out one.
Well, Amy, you beautifully remind us all about the power of environment. If you wanted to grow a bonsai tree and it wasn't growing, you would move it to a different environment. You just wouldn't blame the tree or think it's just that the tree is not a good tree, right? You would, first of all, try and give it a different environment. And you really show the power of environment. And I'm thinking, if you were doing a little elevator pitch, because I know that you're so passionate about this, what can us fitness clubs do to help where we're at now? What could we do? What's the elevator pitch?
Yeah, I think that I'm always looking for action items. What can we do? And I think with the Physical Activity Alliance, much of what we're trying to do, and what my platform as president this year is focused on, is really communication and community and short-term wins. So when I'm thinking about community, I'm thinking about, we as Physical Activity Alliance are bringing together all different types of organizations working in the physical activity space. So again, the right hand's talking to the left, and we're getting rid of those silos, and we're all at the table with a unified voice. So we come from healthcare, we come from healthcare integration, we come from, Dr. G, to your point, we have a lot of representation from the health and fitness centers. We have athletic trainers at the table. We have all the exercise professional organizations at the table. We have physical therapists at the table. We have technology at the table. And really getting everyone at the table, so we are an inclusive community using the same voice to elevate the importance of movement and activity, and the fact that we need to really focus on expanding access to physical activity opportunities, so it's part of the daily lives of everyone. So that's
the key, isn't it? It's open. It's opening, and I guess as society splits more in terms of those that have and those that don't, that challenge becomes greater.
Yes,
because I think there is. I think we're sort of going back to the 1800s, where you have very much those that have money and those that don't. And I think that gulf in the middle of this, what we used to call the middle classes, is sort of
we still see health inequality, don't we? Which
absolutely massively. Is the Physical Activity Alliance, is that national? Is it fully US?
Yeah, it's very US centric, I would say.
I was just wondering, because it's still, I mean, that's like 50 odd countries in itself. So it's a huge role that you've taken on there.
Yeah, we are really, and we represent all different aspects of physical activity. We're focused on adaptive and inclusive fitness. We're focused on technology. We're focused on, as I mentioned, healthcare integration. And so some of our key initiatives you asked about, so really focused on community, focusing on communication. And so we have a regular newsletter that goes out to the physical activity organizations, really thinking about the research and the evidence base, linking mental health, physical health, and movement. And then we have a couple key initiatives. And Dr. G, I know one will be near and dear to your heart. We have something called the CEO Pledge, where we're working to get CEOs of all different types of organizations to sign this pledge, which really commits to creating a culture of movement and ensuring that movement is a social norm in the workplace, not only for workers, but for the leadership as well. And so we can lead by example. So I've signed the CEO Pledge, and so really working to get as many signatories as possible. The other thing that I should mention, Ryan, you asked, we are US centric, and we opened up by talking about the differences in our healthcare systems. And when I was doing my research on exercise prescription and referral, all of the best practices came from Sweden, UK, New Zealand, Australia, not the US. But one initiative that we're working on, which is very US centric, is working to integrate physical activity assessment, prescription, and referral as a standard of care in the U.S. healthcare system. So every single clinician would have a conversation with every single patient about their physical activity levels. They would be supported in that conversation by electronic health record system that allowed the capture of that data. And then it would support the clinician to refer to an evidence-based program or a qualified exercise professional, and really working to link the clinic and community. And so, yes, very, very focused US, but also as we're seeing what's going on more and more with collaboration around the world, I think different organizations coming together to work to unify our sector, the physical activity, sport, and fitness sector, where we're moving toward a more unified sector where we can take best practices and successes from each other.
Oh, amazing work. Truly amazing work. Amy, when I meet you, I've never, ever, it never fails me to be so inspired by your passion for this. It is just incredible, the work that you do. And I think on behalf of, everyone out there, that should be a massive thank you to you, that, you are really raising the voice on the importance of this. I think that the future is bright for the work that you do. I'm really also hoping that we see our fitness clubs really take on board your advice about, working with communities, because even, something that I'm passionate about with the corporate market, I do think that our fitness clubs could be doing more work to support corporate organizations and their local communities as well. Just another ecosystem. And I think that that's the message that I get from what you've talked about today, is that this is a big ecosystem and we've got to come together. And you've gave me a huge amount of food for thought. I don't know what you think, Ryan.
Oh, absolutely. I think it's fantastic. Yes, I think the work that you guys are doing out there, and I know our systems are different, but I think once we get them linking in the right way, I think they're pretty much the same. I think maybe yours is a little bit more financially driven than potentially ours is. So I think that's the big challenge you guys will probably have out there, is trying to convince the doctor that exercise is better than Pfizer's pill that they're getting paid nice commissions on. I think that's always going to be your challenge. They're less so over here, but I think that's always going to be a battle for the physical exercise industry in America. When you're looking at referrals, you've got to get the right doctors in the right places, haven't you, over there, who are willing to support you.
Well, thank you for your kind words. It really does take a community. To your point, Ryan, we do have a lot to overcome when the immediate default, the first line treatment is the pills, the medications. And so a lot of the research that's so interesting to me is really building the evidence base for physical activity as a first line treatment for mental health conditions. And I think that's where we're really starting to move the dial.
I mean, Ryan, not to finish on a controversial point, but I know that you're very vocal, and rightly so, that we've got to stand on our own 2 feet and not, sit back and wait for our governments or some, organizations that exist to support our sector, because we know that that's, not always empowering, and it's also a long-term strategy. But there has got to be the question asked why there is not some subsidy as an option to get people into a fitness club rather than the more medicalized model. And I think that what Amy's really, really reminded me of is the beauty of coming away from that older fashioned medical model to a prevention model. And it's just something that I think our industry should definitely get involved in, because we are prevention for sure.
Absolutely. I think that came up yesterday when I was listening to the Surgeon General speak. I think a lot of the time we pay lip service to prevention, but our financial incentive system doesn't support that lip service. And so I think we need to really
even it up a bit.
Yeah, absolutely. And really it's about framing and positioning what I always talk about the life-saving and healing preventive power of movement and physical activity, and we need to beat the drum and demonstrate the really critical role that health and fitness centers play, and that we are in the community. We're not talking about clinicians showing their patients how to do squats. They don't have the expertise, they don't have the time, but we as a health and fitness sector do. Yeah, and so how can we connect the two? And so that, to me, I think, Ryan, to your point about access, I believe in the power of movement, and I want everyone else to have the opportunity to be able to experience that. We should all be able to experience that.
Agreed. Well, Amy, it only takes me to thank you again for the incredible work that you're doing. We're definitely going to keep following your story. The more you can tell us about your move to live concept, the better. It's just such an amazing idea. I just want to thank you. I'm sure Ryan might have our closing question that we like to ask.
Absolutely. So every guest that we have on, Amy, we always ask what inspires them to do what they do. So whether that's a person, whether it's an organization, or just a belief, but what inspires you to do what you do every day?
Well, and thank you to you both for the opportunity to chat with you. I absolutely love and I am inspired by our conversation. I'd say, I mentioned it already, is that I really believe in the power of movement, and I am at my best when I am moving, and my kids are at their best when they are moving. And so to have everyone, to remove the barriers so that everyone can experience that, and that power of movement, that's what gets me up every day.
Wow.
Fantastic. Well, on that note, we'll leave it there. Really appreciate your time. I hope you have an awesome rest of the day, and we will catch up with you soon, very soon.
Thank you.
Ryan, do you want to just give people the heads up of how they can reach out to Amy?
Absolutely. Obviously, as always, guys, we'll put your details at the end. So obviously we'll put any links to your book and so on as well, Amy. So if people do want to reach out to Amy, find her on LinkedIn. Can't miss her. And then obviously reach out to the various organisations as well. All the links at the end of the podcast. So absolutely. But thank you very much for your time, Amy.
Thank you.
Thank you, Amy.
Thank you.